Imagine with me for a minute that you were a patient in a hospital who has just been in a car accident. Your face is slammed against the airbag. You've been injured. Glass is flying everywhere. Your tongue, your mouth, your speaking apparatus, your ears—they've all been kind of thrown off whack. You're having a hard time speaking and communicating. Well, your nurse proceeds to walk in, not knowing, what extent your injuries are, and she tries to start, finding out what kind of symptoms you are, how extreme they are, how how hard of a time you're having with, speaking in general. And when she starts to interview and ask you these questions, you can't even answer. So how does she respond to that? Well, hopefully she knows how to adapt, to the situation. She knows how to improvise on the spot and figure out a way to come up, that you can give her some information. But if she can't, then what happens? Um, I mean, she might not get the information she needs. She might not. And if she does, it might not be accurate information. It might not be, quality. It definitely won't be 100% right if she can't, figure out a way to, improvise and get past the whole kind of good speak kind of, problem. So, therefore, I would submit to you that communication skills are essential for any work style in any environment, not just hospitals, but in any environment, teaching, accounting, etc. Nothing would get done, and even if it did, nothing would get done right. As stated a minute ago, the information might not be correct, it might not be accurate, it might not be clear. Things get jumbled, kind of like that telephone game you would play when you were a kid. So, to further gather some information on this subject, I found an article by Fiona Timmons called "Manager's Duty to Maintain Good Workplace Communication Skills." And the article essentially covers three basic points. It discusses how it's a nurse's duty to maintain adequate communication skills and how managers can help with that. It also addresses how it's the manager's ability to communicate using conflict resolution abilities, self-awareness and evaluation abilities, and other means. And thirdly, it argues that that shared government or governance is a good thing instead of a bad thing. We would know shared governance as empowerment. This is another word for that. So firstly, as stated a second ago, the first part of the article addresses how it's the nurse's duty to maintain, good communication skills and how managers can help. So, it's very important that in this case, any employee, but in this case a nurse, be able to communicate effectively with their patients, etc. Well, the patient's family, etc. So, one, they should be able to recognize stress and anxiety, worry, and to reassure, to provide understanding, anything to comfort their patient if they can. Secondly, they should be able to keep clear records of the situation. Communication isn't always verbal. It's not always speaking. It's not always over a telephone. There are letters, there are memos, emails, and records. So or note cards. So if the records aren't clear, then information can get jumbled, wrong prescriptions can be given, which can lead to lawsuits, which can lead to people being fired, which can lead to all sorts of bad things. So negative consequences can definitely occur from that. Thirdly, the nurses should be able to respect confidentiality with their patients. I'm pretty sure that's just that's just in the contract. It kind of comes with the territory. Lawsuits can occur. Obviously, business can be lost. People will go to other hospitals or other treatment centers. Also, they should be able to treat their patients in a way that isn't discriminatory. Everyone gets equal treatment. I mean, that's in the Constitution, amendments, etc. And so, non-discriminatory actions are very essential for, avoiding lawsuits. There we go again. But also, it just provides for a more open, friendly form of communication if you can remain objective in how you treat people. Just be interested, be friendly. Now, managers can help with these steps by being role models. They can perform these steps themselves, and the nurses can see how they act, and they can, be inspired by that. They can take that example to heart. Also, the managers can help by being open and respectful with, open and reasonable with their nurses. So, if their nurses come to them with a problem, they should be able to address that problem in a manner that's, friendly, personable. And thirdly, they should be able to respect the nurses or patients or families' patients that they talk to. And I think that respect is probably the most inspiring out of all three of these issues because, because respect is such a vital part of us. I mean, no one really wants to take orders from somebody who treats you like a dog. It's just not, that doesn't make for a good, efficient, shared workload, happy work environment. And there are effects, there are negative effects of conflict that can occur if people aren't, if managers aren't, good role models, or if they're not, reasonable or, respectful. Obviously, then it can result in the managers and the nurses not getting along. It can result in, as I stated before, lawsuits. It can result in failed treatments. People can be injured or killed because of failed communication. Which brings me to the second point, which is how managers are to communicate using different communication abilities, such as problem resolution, self-evaluation, self-accountability, and reflection. So first off, problem resolution, from personal experience, is one of the most important social skills someone can learn, whether in a formal or informal environment. I've run into problems with people, and it's important to be able to just, address the problem head on, just get it done, be friendly, but not like weak, be bold, but not, so confident that it turns the person, away from you. Just, address the problem, identify your options, be humble, don't realize, be able to realize that you are not perfect either. And as I spoke of just a second ago, that balance of, that equilibrium of being right in the center, right, not too far left or right. You want to be, strong, but not too strong, weak, but not too weak. As far as self-monitoring and self-evaluation goes among managers, if they're aware of how they communicate, it's going to be a better example and help them be a better role model. So when a manager is trying to keep themselves accountable, it's best to, be aware of how they communicate, make an effort. It's not, it has to be an intentional thing. And when you reflect on your interactions, try and keep the person you were talking to in mind and think more about how you can make other people the focus of your conversation. And thirdly, the article talked about how shared governance or empowerment is a positive thing. Some people would argue that it's not. However, it can result in creativity, which results in innovation, which results in new solutions to problems that other people haven't thought of, which can lead to new businesses. It can lead to all sorts of good benefits. Also, there are some other benefits of empowerment, such as open communication, which, as we mentioned a little earlier, is good for just a healthy work environment, friendliness, and it can also result in a shared workload. So, just like one manager doesn't have to deal with all the work, it can be a result of multiple people, sharing the burden, doing an equal amount of work, etc. So, in conclusion, I was really impressed with this article. I like the knowledge a lot. I don't always like to be blown away with huge amounts, but it was very well written, very knowledgeable. I was impressed, and also the information in this article was helpful in all aspects. Not just nursing, but it can be helpful in an accounting environment, a teaching environment where you're working and helping people all day. And I'm really going to try and take it to heart. Hope you will too. Thank you.